I'm Yanis Fougias. I'm a consultant neurosurgeon. I work in the Aberdeen Royal Infirmary and I perform spinal and intracranial procedures. I would advise patients who have significant pain affecting their lifestyle to have a spinal operation if the pain is affecting substantially their well-being and they want the most effective treatment, which inevitably has a small risk of making them worse. Sometimes in the lumbar spine you can have either a disc bulge or wear and tear pushing the nerves that come out of the spine and supply the legs. And this pressure on the nerves causes severe pain. Our main aim of surgery is to relieve the pressure from the nerve. So we always operate from the back. Put the patient lying flat with the tummy down, and what we do is we strip off the muscles between the bones. And what we have is we have an area here which hasn't got any bone at all. It just has a ligament. And what we do is we remove that area. So we remove the ligament and sometimes a bit of the bone, depending on how much space we have and how much space we want to create. And the next thing we find is the nerve. If the problem is caused by a disc bulge, we trim the disc bulge. If the problem is caused by a swollen joint, we remove the part of the joint which is pushing the nerve. The principle of surgery is the same, to create a window between two adjacent bones which will enable us find the nerve which is pushed and remove what is pushing it, either the disc from the front or the wear and tear from the back. And that's why after the operation the leg pain gets better quite soon, because the pressure gets better quite soon. And that's why sometimes you have stiffness and discomfort in the back because of all the stripping of the muscle around the bones. This operation is thankfully not very risky, but the main concern that we have is infection. Thankfully, it doesn't happen very frequently. And the possibility of infection in that area is probably in the region of 1%. And equally reassuringly, we do have quite good antibiotics to clear it. One of the natural worries of every patient who has an operation in the spine is getting paralyzed, going to a wheelchair, which thankfully is exceptionally uncommon. Another risk is to create what we call leakage of cerebrospinal fluid. Another worry that patients have is how likely is for the problem for which they were operated coming back is. And that is uncommon, nevertheless, but it can happen. Generally speaking, when I discuss the expectations, risks, and long-term problems with spinal decompressions in general, I tell my patients that there is between 70 and 90% chance of having a very satisfactory outcome. And I do find that people who have come to that understanding and have accepted the fact that they need to have something done because their problem is causing a major effect in the way they enjoy life or that they can't enjoy life. It's these sort of patients that ought to have the operation.